Thank you very much, Nana, and welcome everyone. I know others are still joining, and we will start uh, because of the time that we have as they join, and also since the session is being recorded, I think it will be okay for us to just start so that we save on time. So I'll start first by introducing myself. My name is Godfrey Uchemokumu. I work at Tostan as a technical program advisor, and I'm also part of the master trainers at the Tostan Training Center in Thiès, in Senegal. And just to let you know that as we start this webinar, this is the 11th year that Tostan, since Tostan opened its door to different strategic partners, aligning donors, governments, and also religious leaders to be able to access the training center and also have the opportunity to learn with us and share as we also, share our our model, which is a which is based or which is an African inspired model. So today we are going to share some of the journeys of what we've experienced for the last 11 years, where we have one of our partners that we are co-hosting with this amazing webinar, and that is Safe Engage Foundation, which are based in Korea. To try and trace how they're able to seminar that they attended in 2019. That is like 6 years ago. So we are privileged to have them here from Safe Engage who are hosting this session. We are also privileged to have some of our alumni who today will be part of the panelists who are coming across different regions in Africa. We have panelists from West Africa, and we also have panelists from East Africa, and that is Kenya and Tanzania. And we also have panelists from Sierra Leone, who is also part of these amazing sessions. So our sessions for today are divided into two. And the first one, as part of launching these amazing results from the TRACER study that we conducted, the collaborative study that we conducted. The first session, we're gonna learn from how this was done. What made the study participatory? What made this data gathering, data collection participatory? What made it different? Because that is one thing we've heard a lot from the Safe Engage team and also other partners and people within Tostan that they feel this was a bit different. So we're gonna have that first session, and then the next session, we're gonna just share the key highlights of some of the results from this study. And they will have reflections on it, and then we will dive deep in. So feel free, as we advance the session, feel free to comment or even to raise your hand, and then we'll be giving you opportunity. My colleague Nana will be looking over at the comments, and also will be helping us to look at, to identify those who have raised up their hands. And please remember to mute your microphone if you're not contributing, so that we are able to listen to others who will be part of this session. So I will start, and we'll start with the first session. And I will introduce the first panelist of this first session, which will be focusing on the participatory approach that was used to collect the data and how communities were engaged in this entire process. And in this panel, we have Marceline Ruby, who is representing the voices of the youth. And Marceline is with us here. And we also have Joel Muita, who is a co-founder of Safe Engage Foundation and also a Tostan alumna, has been to the Tostan Training Center. And we also have John Boogie. John Boogie is a village elder and also a community advocate in Kuria and has been partnering with Safe Engage for years and has been representing the voices of communities in Safe Engage programming. And also we have Faith Mkonyi. Faith is from Tanzania, representing Sisema. Sisema works with children and communities on issues of ensuring that children live a dignified life. And Faith is a communication and advocacy expert as well. And she has been amazing in developing and writing blogs based on evidence. So our role is very key on this, and welcome Faith as well. So we will start the session first by asking a question to Joel. I know we've interacted. I know we worked with you as we were supervising these 8 months of amazing study that was done in Korea in 4 words. I just want to ask you, because you kept on saying that this was different, because I know you have been part of other studies before. What made it different? Maybe you can tell us from the design, from the planning, let us know why do you think it was different? Welcome, Joel.
Thank you, Godfrey, and thank you, my panelists, my co-panelists, and Tostan fraternity, and everyone who is listening. From the start, you mentioned something to do with it took not less than 8 months. You can see the period where since we started the learning up to now we are launching it. We had a very good time preparing for the learnings throughout. And I want to just comment on the process itself and the methodology. Why is it different? Because of the process. And you can see how the co-learning, this Tostan and the Safe Engage Foundation, how we collaborated even on the questionnaire designing itself, where the question we were developed we were collaborating on developing the questionnaire from the onset with active participation. We were used to have some meetings with you guys, online and physical meeting. In fact, you used to come and we prepare the question, and where we packaged the question in a way that even the community can understand it. We used the language, the vocabulary that is suitable for the community where they could understand. And not only how the vocabulary, but how the question were. They were open-ended and encouraged more discussion where the community could express how they feel. And also, the volunteer we used to conduct a research, where Safe Engage Foundation have volunteer across all the safe spaces in those 4 wards that we had the research. And we leveraged on that, where it gave us a easy time, and them were in the planning process until the end. And another thing, how we grouped, we give space for engage different community groups, including a focus group for women, men, adolescent, girls, and boys. And also that one on those focused group discussion created a safe space and inclusive space where participants could openly share their views and experiences. Not only forgetting that, and the response we got from the community itself were very honest with us. They were open and saying, this research is the research that we have participated, which is inclusive. Even it gives us a space as men to air our views, and also women to air our views. So it's not like any other. So that thing gave it just give it an outstanding from any other research that we have been conducting since. And also the language, you see now, the time, it gave us time to even the researcher to interpret it into our local language, which is not normal. Others, they are just go use the language that the community does not understand, and that one gave us can I say a very genuine conversation in the community.
Thank you, Joel, for that. And maybe also another thing you could add is the trainings that were also done with the partnership that we also have between the Tostan program team, the training team, and also the MAR, the monitoring, evaluation, and research team. So maybe about the training, maybe once. Yeah.
Yes, thank you very much for adding and reminding me something which is very crucial to Safe Engage Foundation, which it's a tool for us since 2019, since we got trained from Tostan, where we could have the skills and the approaches in our community, where made us to be part of the community, not to dictate to the community, but even what we are doing, community to feel they own it themselves. Because since then, Safe Engage Foundation is now operating like different from other. If you go to the community, you are welcomed and accepted to the community. This is the reason even we can go to the community where we don't use anything. They don't ask us anything. Let me just say that, because of what we learned from Tostan. Because of that, we give community the, can I use the power? The community, they feel they own what we are doing, as we are there to just join them, to support them where we can. But you see now, even let me just take you back where you attended a certain we went with you to the learning, where we went there and found the community waiting for us before time. Imagine, it's not normal, before time. And also where people, they came more than what we expected, and they literally went with the refreshment. They decided, now we will share with all of us what we have. So that one shows how the model of Tostan really impacted much in our organization. And right now, we are very proud to see this report out, and it's carried the voices of everyone, no one left behind. You see, that model of the Tostan, it's what we are practicing until now. And you can see the report, and it speaks to itself now. Thank you.
Thank you, Joel. Maybe now I'll go to Marceline Roby. How did you feel, Marceline, when young people, not few, a lot of young people, actually just to enlighten our guests, the research reached, research participants were more than 250, and majority of them were young people. So I know Marceline, as a youth advocate, how did you feel when youth voices were given opportunities, when young people were engaged? How did you feel?
Okay, thank you, thank you. My name is Marceline Roby, a young peer advocate at Safe Engage Foundation. According to me, I felt hopeful because young people were given a chance to speak out, and also it matters to me because we were not only counted but we were also listened to, we as young people, because when young people are involved, at least the number sounds real, because we as young people, we bring a good picture when we are involved in something, you know. And also me as a young person, I feel so good because we as young people, we were given a chance. And also I feel my feeling is gratitude because we as young people, when we're given a chance to speak out and air out our voices, I hope we are going to do it better and better again and again. Thank you.
Thank you, Marceline Roby. And I know that is very close to your heart because you are a young advocate in Korea. And over to Boogie. Aha. Boogie, I met you not once, not twice in the community. And I know you are a highly respected community leader in Korea. And you have been actively participating. And maybe you can share with us, why do you think this research was different? Because you've told me some things I don't want to say. I want you to say yourself that you felt it was different. Because the kind of questions you're asking me during the launch of the result in Korea told me that it really moved you. So, Boogie, it's open for you. John Boogie, please share with us. Karibu sana. Oh, Boogie, are you talking? Maybe we can't hear you. Your microphone is muted. Is technological issue there? Okay, maybe as we wait for Boogie to sort out his mic and his technology, because I know he's in the middle of the rural part of Korea. Maybe he's having some internet problem. I will maybe invite Faith. From what you're listening, Faith, I know in Tanzania and Zanzibar, we're about doing the tracer study. But from what you're listening and what you've read from the report,
Yeah.
do you really feel that, the pathway is making sense and a lot of things they realize are resonating with what you are anticipating as SISEMA? Yeah. Welcome, Faith.
Thank you, Godfrey. I think yes, and maybe I can speak about what from my experience as the communications person, but also just like in my everyday, like day-to-day life, which also this model also comes into play as well, like I mentioned yesterday. But I just think that the value of studies like this for the work that we do, it goes beyond just implementation or collecting evidence. It's always about accountability and learning, and that is what we have seen in our work in the implementation of the projects that we do after implementing everything that we've learned from you and from Tostan. And we know we often say that our programs are community-led, but in truth, unless we intentionally go back and ask the communities what actually changed and how it changed and what is still working, what is not working, if we don't involve them, then we're only telling the story from our side. We're not having their side of the story. And after reading this report and also like and comparing it to our work, what stood out to me is that the approach it reflects the philosophy itself of the entire system, of how the communities are supposed to lead and we're supposed to facilitate that and not drive it on their behalf. And the research it wasn't something that was done to the communities. It was done with them, which is, again, it goes back to how even in involving the communities themselves in the work that we do, which is why it's important. And the fact that the tools that were used in co-creating were very into the context of the communities themselves, the language, the culture, the relationships, and the realities of these people. You could see them within the report, and that's actually very important because they help to ensure that we're asking questions that are meaningful and not just going there and collecting information and making sure that it reflects our reporting. But perhaps what I think is most important, especially like from my experience, the communities, they become not just the recipients of the activities or the programs. Now they have the knowledge, they hold that, they simply they validate our assumptions compared to us giving them and making sure that they follow everything that we tell them. This approach, it challenges them in a way that makes them think of what they want for their own communities, and which is what I liked about the report. Is also what I liked about the approach, and also is what I'm seeing within the work that we're doing.
Thank you, Faith. Back to Bowie. Bowie, can you come now? Maybe unmute your microphone. And did you hear my question? Or we can't hear you. Unmute your mic. Okay, unmute your mic. We can't hear you.
Yes.
Okay, maybe. Thank you, Bowie. Now we can hear you.
Very well, thank you. Sorry for the technical. I'm Boogie John by names, and village elder, Migori County, doing community advocacy, Save and Engage. You did ask a question. I pick it from this.
Thank you, Boogie. Did you hear my question? Okay, back to you. I think you're muted again. I asked you, how did you feel?
Yes, now you
about. Yeah, so I was asking, how did you feel about you being involved in the process? I'm just summarizing it. And how did you feel? Because you were really excited. I remember even when we were sharing the results in Korea, you were really excited and you were really following it to the latter. And you were really keen, on understanding even the history before and why things are changing. So my question is, how did you feel about how the research was done? Because you were one of the participants in the research and you're also part of the day when you were sharing the results. So how did you feel? And did you feel like this was the true reflection of how things are? Yeah.
Thank you. I was excited, it's true, and even now I'm very excited from the interaction that we had. I realized that what was carried on, it was a purely people-centered, that is a community-led approach. And as a village elder, I'm a first person on the line. I have a first-hand interaction with the community members. So the resultant, the package that was derived from the research, it clearly gives a true picture what the people on the ground need and what they yearn to be assisted on. That is part one. Part two, members of the community were able to front their views, and through uh, uh, what we call dissemination of information, because that is a challenge they generally have, to have the know-how on how to manage their issues. So once they get the right information, they get empowered. Yes, sir.
Thank you, Boogie. We'll come back to you. So on this first session, we have 5 minutes, to go to the end. And Faith said something important that if we had a strong feeling like there was a huge investment, and maybe just to let our participants know, this was a huge investment and a commitment that Tostan made, to really go back and learn from what we've been able to do with our alumni who have been able to come to the Tostan Training Center. And it involved a lot of planning, a lot of team members. The planning actually started way back in 2024, and the study was delivered in 2025. And even developing the tools and even planning, with Joel and Christine and the team also took time, and it took a lot of resources. And this was actually funded by Tostan. And we were really inspired because we felt like this was worth it. And we encourage partners who are part of this engagement to be able to emulate this, to be able to design studies that put people in the center. It takes time, it takes resources, but you will not regret. I was part of some of the interviews, the focus group discussion, the one-on-one, the key informal discussion, the level of participation, the zeal, the dialogue, they were taking long and nobody was bored. I have been an interviewer before, a researcher before, and I saw amazing thing. And that is why this is very close to my heart and very close to the heart of Tostan team. And thank to our Tostan Mart team and our leadership for supporting this. So for the 3 minutes, we'll open for question. If anybody has a question or a comment, now I will request Nana to help us, open it. And if there is any question or any comment on the chat, please let's bring it up. So we have 3 minutes for comments and questions. Welcome.
Thank you
Nana,
very
help
much,
me.
Godfrey. If you have any questions, if you have any comments, please, you can raise your hand and I would unmute you to speak, or you can also put it in the chat. And welcome to everyone who's joining us from different parts of the world today. Thank you very much for joining us. The second session is going to start after this. The second session is going to focus on presentation of the results from Migori County. And before we do that, before we do that, I'm going to wait to see if there's anyone who has questions. Any questions? Any questions? If you have any questions, please raise your hands and I would okay. While we wait for questions, I'm going to go ahead and present to you this amazing study. This study started last year. It was through a very diligent collaboration with Tostan. I mean, I say it started last year because that's when we started the detailed documented research. But the relationship with Tostan and Safe Engage Foundation started a long time ago, back in 2019, when the first set of SAFE participants arrived in Chess in Senegal to be a part of the Tostan Training Center community, where they met with some of our very esteemed trainers who, including but not limited to Molly, Dam, Birima, and some other people who I'm not mentioning their names at the moment. And that training, that that seminar, that introductory seminar, led to other subsequent seminars in which some of the SAFE participants also re-engaged in. It led subsequently to other step downs that they conducted in their hometown in Kenya, and also some cascading of knowledge down to people who they share and learn with in Migori County. In addition to that, they also collaborated with other Tostan alumni who work in the similar environment, doing similar things with them. And all of that has yielded some of the results that we see today. When we started this research, we asked ourselves one big question. We know that for the past 30 plus years, Tostan has been practicing a community-led approach to development. And Tostan has its CEP, Community Empowerment Program, that it implements directly in the communities that Tostan works physically in. And we said to ourselves, we want to see, how does this community-led approach work when it is adopted and adapted by a partner organization that is not Tostan, operating within its own context? And what impact will that approach have on these communities in those partners' context? What did we do? We decided to sit down with this partner, talk about their context, and design research that will help us find some of the answers to this. What we did was we had 20 focus group discussions, we had 20 key informants interviews, we have 8 teams that we have identified across this question, and we had over 250 participants in this process. What did we find? Here's something we learned from these communities. We learned that the community-led approach indeed transfers. Not just does it transfer, but the transfer process works. This is why it works. SAFE did not just replicate Tostan's model of the CLA. It's not just copy and paste. They translated those principles, the fundamental principles and the key aspects of the community-led approach into Korea using the local language, Swahili. They used proverbs and they worked with the existing structures in the local communities. And we learned that when communities define their own problems, as always, they will own the solution. The second thing we learned was that change was holistic and mutually reinforcing. The communities did not just experience change in one dimension. They saw shifts across health, education, economic participation, and gender norms. And they made these connections by themselves as we spoke to them. The women were linking economic independence to reduce violence in their homes and in their communities. The young people were linking education to FGC refusals. Now, we also saw that the social norm shifts were real. They were also cross-generation, old, young, women, men, and they were gradual. It was not instant. Like I said, SCF came to Tostan in 2019. This is 2026. Now, the FGC reduction was reported across all the wards that we surveyed. The girls were staying in school much longer. The adolescent boys were championing the rights of the girls. Men were intervening in GBV rather than just looking away. All the respondent groups that we surveyed, all of them, they reported these shifts. We also saw that the ripple of the community-led approach extended beyond direct participants. The knowledge cascaded from Tostan to SAFE to community members and then to the wider community. Some of the participants were telling us that the neighboring communities wanted to participate in what they were doing. What are you doing? We want to adopt your approach. We want to see what you're doing. We want to learn a bit more about what you're doing. We want what you're doing. So in some communities now, the demand is community driven. So it's no longer program driven. We did see that community gaps required honest acknowledgement. One of the things that also came across is that men wanted more involvement. They wanted more involvement, and they identified gaps and also made suggestions about how they can get better involved. We did see, however, that where communities have neighboring communities or wards who have not incorporated their approach, social norm change requires a lot more effort. And sometimes people who have not adopted or adapted to the community's new way of thinking might seek those older norms across the borders. We saw that the community-led approach saw emerging changes in peri-urban context because SAFE, or SEF as we call it, also works with schools. So we saw that there were mobile populations. Mobile because children who come to school also go back home to different communities and go back home to different norms and different values. But we also saw that in these spaces that had a weaker central or traditional authority system, we tested the assumptions of community-led approach, even in that rural design, and we saw that SAFE adapted it on the ground without a formal toolkit. So it meant that these approaches were able to work in school environments, school communities, market communities that are more mobile. And these communities themselves started to propose some new technologies that can be inculcated into this approach to help adapt it to the way that fits into their mobile structure. And some of these approaches included radio, social media, and intercommunity exchanges as scaling channel. In summary, before I hand over to Godfrey, all these 6 points were things that the community said to us. I would deeply encourage us to engage in this next session that would have Christine, who is the founder of Safe Engage, Willie Kista, Fatuma from CSEMA, and Elizabeth Banye. You would hear that not only does this approach work in Kenya, but we have also tested this in collaboration with GFC a couple of years ago, and we found out that this works in Sierra Leone and Liberia. And as you listen, I hope that at the end of this session, you would have not just understood a bit better about what we have experienced, but also reach out and ask us more about this community-led approach. I'm going to be handing over to you, Godfrey, and so over to you, Godfrey, and thank you for listening, everyone. And we move on to the next session, When Communities Lead, the results from Migori County.
Thank you very much, Nana, for sharing that passionately, because I know you are part of this, part of this process. That is really, really inspiring and, really encouraging us at Tostan continue with what we are doing. Because when we learn of these results, it really encourages to really continue with the amazing work that we are doing. So now I will now move to the next panelist. And on the next panelist, we have, as Nana said, we have Christine, who is the founder of Safe Engage Foundation. And we have Wilkista Adhiambo, who is the program lead at Safe Engage. And also we have Fatuma Ahmed, who is the director of program at CSEMA Tanzania. And we also have Elizabeth, who also is a program officer and a program, a trainer also at WAVES in Sierra Leone. And they will be sharing with us their experience across the different regions of Africa. And I will start first of all by Christine. Christine, you've heard about the results and you've read it, and we were with you when we were sharing with the community, and you were able to see the excitement in their eyes. And also just to let the team know that Safe Engage is actually developing their next strategic plan. And their next strategic plan is highly informed by the results from this study. So Christine, why are you so much excited about these results? And, why, floor is open.
Thank you so much, Godfrey. Thank you for opening this up. And thank you, Tostan, for working with us this journey. And all the supporters that have joined us today, we are so grateful. From my end, I am so happy because today it's just showing it's showing clear evidence on localization. Yeah, we went, we learned. We're now translating international learning into locally locally owned change. That is the beauty of it today. So I am so grateful today that this research shows a Safe Engage Foundation not only an implementing partner in the community, but also we going into the deeper part of showing evidence of what is working. And for me, it's the beauty of seeing this evidence that is going to inform our programming, evidence that is going to inform and shape policies. I also broaden the community-led development movement. You know, how you hear the community say about economic empowerment for women, how the village elders are actually saying how they develop their own work plan and share with Safe Engagers so that we can incorporate them, including the boogie being part of the conversation, the children committees taking up the leadership to actually spearhead programs run by children. All that is clear evidence that community-led approaches are really working and are leading communities to sustainability. That is the whole point that we're here to celebrate today. And for us, when you're talking about community dialogues, it's more of a structured opportunity to actually come together and discuss about topics that are difficult, because unless we discuss difficult topics together, then we cannot develop. So the safe spaces that we create in the communities through the locally led structures, that is the barazas, the women chamas, the children coming together to play and just talk about the difficult issues they are facing. That is what we mean by change. So today we're just here to talk about the real change that is happening in the community, and we can see it, we can hear it echo through those the research findings here. So that's why I am so happy and excited about today. Of course, I have been excited about this from last year when we initially started. But again, my gratitude goes again to Tostan, because as Safe Engage Foundation, we could not do this study alone. You know, there is a lot of resources to get the numerators go there, to get the experience being recorded, transcribed. As a local organization, we were like, how do we even start transcribing? How? But we invested, like Tostan helped us to invest in those gadgets that we needed for this work to really be where it is today. So that is one thing that I am so grateful about. And the whole team that came again to Tostan that didn't want to keep the knowledge to themselves. You know how your team members go and learn and you're like, how do we get now this out? They were very generous to share. That is Joyce Boke, who is also joining in here to listen in. Myself, Joel, and now Wilkista, who has gone an advanced level of Tostan model. We're really grateful that all that knowledge, we've been able to use it to ensure that community-led approaches are well understood. And for us, it was not just copy-pasting. We didn't copy and paste the Tostan model, but we localized it. We ensured that it really made sense in our local context.
Thank you, Christine. Thank you very much for that. Now I'm going to Wilkista. Actually, Christine just called your name. Wilkista, you are a program lead at Safe Engage. Wilkista, you've worked in Korea for years now, as I know. And also, you and Elizabeth in this panel are amongst the few who have gone through the learning journey up to almost the end. Now you are like more of like a certified, trainers for other partners. And apart from just your role at SAFE, you have also been able to train other partners, including Luala in Migori, Shoko across the country. So my question to you, when these results were shared, and now you are in SAFE, what surprised you, or what excited you? Because you're really invested your time as somebody who is a trainer on this. Over to you, Kristen.
Hey, thank you, Godfrey, and the team from Tostan and everybody who is watching. So what has surprised me on the community-led approach, because this is where community come together and they can, when communities come together, they can easily identify their challenges. And with these, they come with their own solutions and even get involved in the activities. So for these, it ensures even sustainability, even when the donor fundings come to an end. So what has surprised me is where community now has been coming in together to make informed decisions. Because most of the time we've been making decisions for the community. But for now, they can easily come together through the existing structures like the CHPs, the CMCs, the government officials. They can easily come together, have a sit down, and make decisions on how they can even solve their differences. Most of the time, in the previous years, they could not even have a constructive dialogue to solve their issues. Because most of the time, the community decides maybe they want to fight each other without solving their issues amicably. But with this, the community can now dialogue peacefully and come with their own solutions. And this has been one of the positive aspects of it. And again, most of the times we've been involving women, but as for now, men are now being involved as positive allies because the men now want to come together. Like women are being empowered more. So how can we involve men now? So men are even asking for those sessions. How can they come in and be sensitized too on how to ensure that the community goes a long way positively, where they can easily drop the social norms which bring issues more so to the women and to the girls in the communities. That has been a plus. And then there have been these community barazas. They have been ongoing. Like most of the time, there are those times the barazas were being done in the community, but some of the issues being raised were not helping at all. So with the involvement of the community-led approach in the community, now the barazas can be done where they can hold discussions even when we are not there. Because most of the time they could wait for us to organize for them the discussions. But for now, the community can come by themselves, have a sit down and discuss their issues and come with solutions. And this will even ensure sustainability even if SAFE is not there in the communities. So this has been a plus.
Thank you very much, Wilkista. And now, to our participants, you are able now to really realize why the title was When Communities Lead, Real Change Happens. And now to dive deeper now outside Kenya a bit, I want to go a bit into the West, and I want to go to Sierra Leone. Over to Elizabeth. Elizabeth, in partnership with GFC and Tostan, some years ago, we were able to also do another PESA study in Sierra Leone and Liberia. What are the similarities of the result from what you realized the other side and what you are hearing now and what you read in the report? Kindly share with us and also share with us some of your experience based on the topic of when communities lead, real change happens, because you are a living experience as well. Welcome, Elizabeth.
Thank you very much, Godfrey. I am Elizabeth Kasabani, working with WAVES, Women Against Violence and Exploitation in Society in Sierra Leone. So I just want to extend my appreciation to Tostan and also GFC, who have given us the opportunity to go and learn from Tostan, and also Tostan willing to share their ideas with us and even support us when we are back. Thank you very much. So from the results, I saw, reading through the results, I saw that there are similarities. The results and from the studies has given me an idea that when you work with communities, allowing communities to identify their own issue, discuss, and make decisions all by themselves, then real change happens. Even if you are coming from different area, it works all over the world. So through those continuous ongoing dialogue, respect for human rights and responsibilities, and also strengthen the existing structures in the community, then it has made it possible for community people to speak out, to take collective action, and to come together to respect themselves, respect their views, listen to one another, and also build relationship in the community. So for us working with the community-led approach in our own context in Sierra Leone, we have seen where the communities has taken lead in their children's education, because they now know the rights and responsibility, the right to education and their responsibilities as parents. So we saw in one of the communities we worked with, we saw that the community people probe to know, because of the knowledge they have gained, they probe to know why their children are taking public exams in different communities, in as much as they are living in the chiefdom headquarter town. So with the information they got from the school authorities, they learned that that school has not been approved by government. Since then, it has operated in many years in that community. So now they have to find a way to ask how they should be able to ensure that their school is being approved. So the community people themselves mobilized, they come together, they mobilize their resources, and they send people to the city board, to the ministry to know, all by themselves, without even us supporting them. So they went and asked the pathway. So they were guided by the Ministry of Education, and they went back and reported. And after everything, they gathered all the information they needed, the document they needed. They moved to Bo, and they have to travel to the city. They traveled to the city all by themselves, the capital city, Freetown, to the Ministry of Education. And so they went with their documents and everything that is required. And today we are saying, I am proud to say that school has been approved, all by the action of the community people, not us as organizations, because of the community-led approach, the information they have got, they now have the knowledge, they have built the capacity, they are confident enough to go out and advocate for services they do not have all by themselves, and that's which they cannot provide locally. So with the community-led approach, we are saying that communities are taking lead and the results is lasting. And also we have seen where they have also advocated for their school. So, I mean, we are seeing where the communities mobilize their resources also to support teachers that are not on payroll, who are teaching in their schools, but they are not on payroll, just to motivate them to educate their children. Because when we introduce the community-led approach, through their vision, one of the things is to promote education, their children's education. And promoting the education, so they started to probe into certain issues to know why this is happening, that is not good, why this and that. And so because they prioritize education and health first. And now because of this, they are taking steps. Now we are seeing how the community have come together to support their children's education. We have seen how children, especially girl children, but they are going to school, the intake is being increased. And also we are seeing how the children themselves taking responsibility also to know that if this is what our parents are doing for us, we have a responsibility too. So we are seeing how the community-led approach is working. And like now the people know, before this time, they said to us before this time, they only accept, they are always willing and accept what NGOs take to them. But now they are telling us that in as much as they know their rights, they know what they need, you cannot just come as an NGO to come and give them what you have. So for an example, they told us that IRC has been working with them for some time. They will come in when the funding is done, then they wait. When they have fund, they come. So for the third time now, they are coming because of the community-led approach. They came to continue their work, and the community, they were willing, happy to receive them. But they told them that this time around, you have been engaging us on sanitation, on how to take care of our children, our homes. But this time around, we have one thing that we want, and that is what we want you to do for us. And they say, what? They say, then they have to tell the community, that the NGO, that now we have our health center, and this health center is dilapidated. So we want, other communities are using this health center. So we want you to renovate the health center for us. And that would be we will appreciate that for us. And then IRC accepted what the community people themselves asked, because that is what they want. So they renovated the hospital. So what happened was that the community people provide the local materials that are needed. They mine the sand and transport it to the site, and they provided stones and other materials. And so they also support in this unskilled labor. So that is how the communities are working. They are taking responsibility of what they want, and they now know what they want. You cannot just take anything to them and give them. They know what they want. They will tell you, if this is what you have come with and this is what you want, then do what you want. Thank you.
I know Elizabeth has a lot to share, because there are amazing experiences across Sierra Leone and Liberia, that when communities lead, real change happens, and they even sustain the action. So, because we're almost on top of hour, I will take this opportunity maybe to invite Fatuma from Tanzania, who is also program head and also at Tostan Training Center Lumini. And I know your new strategy as well has been inspired by this. To also share with us from what you're listening and what you have already experienced over the years. What can you say as Fatuma from Tanzania experience? Welcome, Fatuma.
Thank you so much, Godfrey. And it is such an honor to have you and Nana. And, I'm seeing faces that I met at Tostan 7 years ago. And to hear experience from Sierra Leone and, the expert trainer for Tostan model. This is really a great opportunity to share this. So this is amazing, and it's really true that when communities come together, changes, real changes happen. So we have had this projects that have been there for a decade, focusing on addressing sexual violence against children in Zanzibar. And we have been seeing changes, but when we brought in the community-led approach from Tostan, we had actually seen the communities really come together and, bring in this multi-dimensional improvement that we didn't expect, because we have had this idea of, drafting the proposal, coming up with the idea depending on the research that we've read, the national surveys that have been done. And, you go there in the community saying, this particular area in Zanzibar, there is prevalent of child sexual violence. And then you go there, you say, we have come here to address sexual violence against children. And even the way we have structured the project name, at the beginning, we didn't see there was an issue until when we brought in the community-led approach and, learned about how to message, how to communicate, how to use the local language, not to put the blame on the community, addressing the communities like they are to blame, they have these issues, but to let the communities come together and reach consensus. So this model that we've using is multi-layered. We have the children, parents, community leaders, religious leaders, and parents together. And what we've seen is when you let them come together and organically have this discussion, they tend to see like this is really our problem. We own it, so we have the solution, and you have like to give a room to listen to these solutions that they have, and your work is just to foster the approach towards addressing these issues. So we have seen children's self-efficacy grow. We train them to notice the type of sexual abuse, who does it, where it happens, reporting mechanisms. But when the communities came together, then these children had the support system. That's when you, at some point, we had this dialogue for the first time. The parents are saying, we have gone through different trainings, we have attended government sessions at local level, but we haven't had a chance like to dialogue with our children. We haven't had a chance to hear our children talk about this issue, especially sexual violence. Sexual related conversations with parents, like the parents themselves saying, this is really a great opportunity, and we don't feel shy, we don't feel bad talking about issues of sexual violence, but we are now open and we are ready to like listen to our children and provide support that we have. At the same time, this is now the conversation between parents and children, and we see like now we are creating safe homes, yet and the outside system, which is the local government, the religious leaders are also there to provide support. So you see that you have children with knowledge, but you also have this support system because the community came together to discuss, and they own the problem, and they see like this is our initiative, and the change that we need is actually for the well-being of our community. And apart from that, we've seen like the community go beyond the topic that we are trying to address and bring in other issues that are affecting their children, from preventing sexual violence to now advocating for children's staying in school, preventing child marriage. You see parents who have attended the training in our program, supporting children who come out to say that this parent is wants me to stop from going to school. They have found someone to marry me off, but the parents support, and the justice system support, the community leaders support. And then we have seen where youth who were involved are getting out of their comfort zone from the classrooms that we held with them, to mobilizing communities, come out and, make sure they have, they create safe spaces for children. They clear the bushes to the ways to school for children. They even gather businessmen that we never thought they will be part of this intervention. Now, they had identified, more risk areas and reasons that are like fostering children's sexual violence, like these businessmen who like have bar around the communities, who like have video centers around the communities and allowing children. So they had to educate the businessmen to know that it is not safe for children to go in these video games, have bars around. The people who are building houses around the communities, and they abandoned them, they made them clear the bushes, have securities around those areas. So you can see that actually when communities come together, real change happens, and the sustainability part is what is amazing. Because when we had these sessions with the trainees, we had incentives, we have transport reimbursement for them. But when they took initiatives for themselves, then we had no incentives to incur, but they organized, they mobilized themselves. But also they looked at community structures that are existing to cascade the knowledge. And they did this when we were not there. Like we helped them, supported them to create community action plans. But after that, they like extended what was in the action plan. Like, they used to, like we used to have madrasa teaching. This is religious teachings for like children. Then they came to realize that there is also madrasa for adult women. So they use those spaces to cascade the knowledge to the adult women. And this is transferring to the families. These women are out of the cohort, are out of the project completely, but now they're like making the diffusion happen in the community naturally, because this is their thing now, the ownership, you feel it. So when the communities come together, really change happen. And we are so grateful to Tostan, and you have been so supportive, whenever we need your support, you're always there, and we have seen really changes.
Thank you very much, Fatuma. I think Fatuma has frozen. Or is it me? Yeah, because I see some people freezing. And actually, our participants, we are on top of the hour. And I think I will now take the opportunity again to invite Nana again, if there are questions, if there are comments, as we reach on top of things. And I know we've got the keywords today. It is important to invest in communities. And if you invest in community structures, you are assured that sustainability will be work. And investing in these communities is also ensuring you design an education program that is inspired by their own cultures, by their own tradition, their own ways of life, taking advantage of existing structures without creating more new structures that they might not sustain beyond the program life cycle. So I will hand over to Nana, and the floor will be open.
Thank you very much,
And
Godfrey.
Welcome, Nana.
Thank you very much, and thank you very much, Session 2 panelists and participants. We do have some comments in this chat. Halima Hussein from Kenya says that the community-led approach has transformed the way I work with communities. One experience that stands out involved a partner organization that wanted to support vulnerable families through food distribution. Instead of immediately implementing the planned intervention, I applied the approach. We engaged the community in meaningful conversations to understand their priorities and aspirations. Rather than requesting food aid, community members expressed that they wanted support to start small businesses so they could generate sustainable income and become self-reliant. We listened to their voices and worked with our partner to align the support with the community's priorities. As a result, 20 individuals received small business investment support, enabling them to improve their livelihood and strengthen their economic resilience. Well done, and thank you for sharing, Halima. There's also another testimonial from Nigeria, from Mr. Benga Adeleke, who says that I would like to sincerely thank Tostan for equipping me with the practical knowledge on the community-led approach to address local challenges. It has sufficiently influenced the way my organization engages communities in Nigeria and has strengthened our commitment to promoting locally owned development solutions. He talked about mobilizing and training community members, establishing a community project committee, and facilitated the development of a draft community action plan that reflects community identified priorities, including child protection, education, and household economic strengthening. So he says that the action plan is currently being harmonized for presentation to the Traditional Council for validation and community ownership. Well done, Mr. Benga. These are really clear examples that the methodology transcends beyond just Senegal and going to different parts of the world and being functional and working. If you have any questions, comments, please feel free to use the microphone for the next 2 minutes or raise your hands for any question. A little bit of housekeeping. I will be sending out, we would put this video on YouTube so people can rewatch. We will also send out a recap of today's session and testimonials in English and in French for people who were not able to use the translator. We would also include the link to the report so people can read and a contact email. Mr. Amos has his hand up. Mr. Amos, please go ahead. You have the floor.
Okay, thank you so much, Nana and everyone, for listening and for everything that has happened. I just want also to put a testimony from my own self that in our journey toward a declaration in Loita, we use the approach and it really helped us. And we are able to make a declaration which bring about over 3,000 people, and also led by the cultural leaders from both Kenya and Tanzania, because we live near the border of Kenya and Tanzania. And that the Tostan model has really helped us to make that happen. And at the present, Loita has gone for a transition where we have given people a land, and it bring about equality, because I think we are the first community in Kenya to be able to give equal right of land ownership to both men and women in equal size. And that is, we credit this to Tostan model because it gives us an opportunity to address community issue on a way that we respect community decision first. At the moment, we are going through something like a constitution maybe, or a cultural guide, which guide us on how can we bring about the law that guide us as a community to solve conflict in regard to land, gender-based violence, and other issues within the community. So I'm so much grateful for Tostan and for everyone we have took this journey together, because we started in 2015 as pioneer cohort in Tostan Training Center, and I've gone there several days, and I'm always happy to go there because I know every time I go, I come with something new. So thank you so much, Tostan, and everyone for the work we have been doing together. Asanteni sana.
Thank you very much. Thank you so much, Mr. Amos. Thank you to everyone who has listened. I want to first of all thank our wonderful anchor, Godfrey Ocheng Okomo. I'm really very grateful for you stepping up and taking this process from the beginning of the design of this study to through the process to this moment. I also really want to thank, this study would not have been possible without the head of Mel Kyla and the entire Mel team at Tostan, the entire team at SAFE. I want to thank you to everyone. I also want to have a special thank you to Ame, who helped us from the beginning to do the Sierra Leone Liberia study, which has now yielded this study and is going to be yielding the Nigeria study that is forthcoming. So thank you everyone who has participated in this process. I would like us to keep up with Tostan. If you want to continue to hear more, if you want to learn more, please feel free to participate in our COP calls. There you have some of the lessons in small snippets, some of the lessons from the Tostan trainers, where we share knowledge and learn from each other. And please take time to read the report, ask us questions about the design. One of the things that we intend to continue to do is to be able to share our process so that other people can replicate this type of study in their own communities to see if there has been any change and if that change is attributable to this process. I want to thank everyone who registered to participate today, everyone who made out time to be here. I want to thank the entire Tostan Training Center team for all the support that they have given to this process, but because without them, there will be nothing to measure. So thank you very much, everyone. I'm really grateful. And thank you for spending your day with us today. And do enjoy the rest of your wonderful, wonderful day. Thank you so much, everyone. Thank you.
Thank you, Nana. Thank you, guys.